The article that I'm using for my research is by Sieverling, Coquitos, Williams. It was written in 2012. They studied a 3-year-old male who was diagnosed with autism. The study was conducted in the range setting of a clinical room with 1 table, 3 chairs, and a high chair. Latency data was collected on the time between bite presentation and acceptance of a bite. 4 out of 12 target bites were presented on plate A, which was non-preferred foods, for a period of 10 minutes. If he accepted bites off plate A, then he was rewarded or presented with bites from plate B, which were preferred foods. The acceptance of bites on plate A within 5 seconds resulted in verbal praise, while bites that were not accepted in 5 seconds were terminated. On plate B, each bite was presented for between 5 and 30 seconds, and for each bite, he was able to select the bite of food that he took. Each meal was terminated after 10 minutes. Even if he didn't take any bites, it was terminated. Differential reinforcement of target behavior, escape, extinction, and fading were used as part of the intervention. The first phase required the client to take a bite of presented food before he was allowed access to escape from meals, and refusal did not result in meal termination. After the client mastered 4 foods, the escape extinction was terminated. Following this taste session were the presentations of the food to the client with a verbal prompt such as, "Take 1 bite and you're done," and then he'd be allowed access to escape or leave the room for 3 minutes. The results of this study concluded that presenting preferred food after a bite of not preferred food did not increase after 5 meals. However, when escape extinction, DRA, and fading were used, the client's intake of preferred and non-preferred foods increased. So what Silverling, Coquitos, and Williams study was very useful when you're trying to assess or change a food selectivity behavior. The implementation technique for increasing the intake of new food was very useful in this article. Their IOA was there was a second observer present in 66% of the meals and 32% of taste sessions. Latency to accept agreements for taste sessions were defined as both observers, indicating a total latency from bite presentation to acceptance within 3 seconds of each other. Inter-observer agreement for latency inter-observer agreement for latency to accept during taste sessions was calculated by dividing the number of bites in which both observers indicated a total latency within 3 seconds of each other by total number of bites. Agreement for acceptance during baseline and treatment meals was calculated by dividing the number of bites in which both observers recorded that the presented bite was accepted within 5 seconds. The IOA for child acceptance of bites and disruptive behaviors was 96% and 98%, respectively, during baseline and intervention meals. The IOA for child latency during taste sessions was 94%. The study was designed as a method to decrease escape extinction. So it evaluated the effects of a treatment package consisting of contingent access to preferred food and escape extinction on food selectivity. And I think I have covered the most valuable of the information. Oh, for maintenance, gains were maintained at 1 month and 3-month follow-ups. They did mention that in the study. For future references for this kind of research, I think that the variables should be a little more clear. It seemed like this study was very full. It was very hard to follow. So for future references, I would just simplify it a little bit. But other than that, this study is totally relevant to behavior change for food selectivity.